2 years ago, President Obama signed into law what I believe will be remembered as the most forward-thinking and humane reform of our health care system since Medicare. Now, just like the Republicans opposed Medicare when it came in, and they still want to get rid of it, if you look at the Ryan budget that came out, what do they want to do? Privatize Medicare. They've been at it ever since. And now they don't want this humane reform that we passed 2 years ago. When the Affordable Care Act became law, I said this. I said, we have made America a more compassionate and a more just society. I believe this with even greater conviction now. And in listening to my colleagues, my friends on the other side of the aisle, you would think this is all just about little nuts and bolts and this and that, but it's about humaneness. It is about compassion. It is about justice. And yes, it is about making the system work better for patients, not just for insurance companies and the insurance industry. Now, we've moved ahead to implement the law. The results have been striking. Every American now is protected against abusive insurance companies' practices of the past. Let me put it another way. Because of the health reform law, Americans now have protections that every senator in this chamber has enjoyed for years. Under the Federal Employees Health Benefit Program, we now have extended that to Americans. Now, I listen to my friends on the other side of the aisle. They want to take it away from Americans, but keep it for themselves. Oh, no, they don't want to give it up. Well, I think what's good for senators ought to be good for the American people. Look at, this is a chart of, I'm trying to get it. This is Emily Schlichting. She testified before my committee last year. Here's what she said. Young people are the future of this country, and we are the most affected by reform. We're the generation that is most uninsured. We need the Affordable Care Act because it is literally an investment in the future of this country. Why did she say that? Because she suffers from a rare autoimmune condition, which insurance companies would not even cover. But because we have said that they cannot now discriminate if you have a pre-existing condition, Emily gets insurance coverage. Plus, she can stay on her parents' health insurance program. So far, the law has extended coverage to more than 2.5 million young people like Emily, and they want to take it away. They want to take away Emily Schlichting's insurance coverage. That's what it's all about. They want to repeal the Affordable Care Act, Obamacare. And what it means is that 2.5 million young people like Emily will lose their insurance. They don't talk about that. They don't talk about that. Now, right now, here's the coverages that Americans have. Banning lifetime limits. Let me read about Ross Daniels and Amy Ward from West Des Moines, Iowa. After developing a rare lung infection on a summer trip, Amy needed intensive treatment, including a course of medication at, get this, $1,600 a dose, $1,600 a dose. Her insurance policy had $1 million lifetime limit. Without health reform's ban on lifetime limits, this couple would have had to declare bankruptcy. After this experience, Ross said he couldn't understand why opponents of the law want to repeal it. He said, and I quote, "It is hard for us to believe that so many of the GOP candidates would have us go back in time where an illness like this would have forced us, or any other family for that matter, into bankruptcy." So, listen to what the Republicans are saying. They want to take this protection away from Amy Ward, Ross Daniels, and millions of other Americans. 100 million people are helped by the banning on the lifetime limits. We've covered vital preventative services free of charge that have benefited more than 80 million people now get free preventative care. It allows young people to remain on their parents' coverage until they're age 26. I can't tell you how many families I've talked to in my state of Iowa who've said this has been a godsend to them and to their kids. Here's the preventative things. Look at this. We all know that prevention is the best thing we can do to change our sick care system into a health care system. So here's what we did. Here's what the Affordable Care Act does on prevention. Before health care reform, colorectal cancer screening was covered only by 68% by insurance companies. Cholesterol screening only covered by 57%. Tobacco cessation only 4%. Under the Affordable Care Act, colorectal cancer screening, cholesterol screening, and tobacco cessation all covered at 100% by every insurance company. 100%, not 57% or 68%, but 100%. And we all know that early screening means that people live longer and it cuts down on health care costs. So millions are now receiving free preventative care. 86 million Americans had at least one free preventative service in 2011. 1 million Iowans in my state received at least one free preventative service in 2011. The Republicans want to take this away. That's what it's about. Americans now have preventative care. They now are able to keep their kids on their policy till they're age 26. They now have a ban on lifetime limits. We now have a ban for children up to age 19 on pre-existing conditions. That's what they want to do. They want to take this away. I say don't let them take this away from the American people.
50 seconds remaining.
Madam Chair, I would yield the remainder of my time to the senator from Michigan.